The World TB Day yesterday, the Department of Health and the South African Football Association have joined hands in raising awareness about the plight of TB in the country and across the world. And in its third year now, the Kick TB campaign seeks to create awareness of TB by infusing soccer and social mobilization to create a platform through which TB messages are conveyed amongst a target group. Now, with Bafana Bafana in action later this afternoon against Guinea Bissau, the Kick TB campaign will be in full swing at the Moses Mabhida Stadium just before the game starts this afternoon. But to find out more about the campaign, we're very pleased to be joined in studio by Dr Lindiwe Mvusi, the Director of TB Management and Control at the National Department of Health. Doctor, what a pleasure. Thank you so much for joining us this morning.
Thank you for
inviting
us.
Doctor, we've been talking about this off air, and I am shocked to find out that this campaign actually started as way back as 2010. Give us a bit of background as to what led to this campaign, when did it start, and how come we don't know much about it?
Well, yes, the campaign started in 2010. And it was the brainchild of a lady from the University of Stellenbosch, Wena Mulich, who approached us with this idea since we were going to have the World Cup in the country, and said, look, there's a lot of people that will be coming through. The soccer will be watched around the world. Why don't we look at this audience and try and send TB messages through whatever media that would be available. So then we started with the Kick TB campaign. At the time, we were focusing mainly on campaigns in the communities, linking them to the soccer. So we had soccer balls and that we had for the campaign, and it was a mobile truck moving from one area to another. And then in 2014, we then approached SAFA with this idea to use soccer as a way of channeling the TB messages, just to reach the many people that actually follow soccer in the country.
So how do you go about, putting across this message during those soccer games? Like, for example, I know Bafana Bafana is playing this afternoon. And yes, apparently you also target Banyana games as well. But do the players wear special kits? Is there a special moment of observation? What happens?
Well, what we do basically is to try and use the banners around the stadium to put messages around there. And secondly, we then outside the stadium have a truck with music and entertainment for people coming through. And obviously then we use that platform to actually relay messages. There are pamphlets, we use soccer balls, as I indicated earlier. And people come through and listen to messages. There are competitions as well, and they win small gifts. And at times we also include screening, so people who want to be screened can be screened for TB, and even HIV testing for those that want to test. And we also have a local, a mobile laboratory that could be used there for testing, so that people then get to know their results on time and are referred to the clinic. At times we then use the opening part of the soccer match for the players to actually read out some messages on TB as well.
Oh, wow. Let's talk about the effectiveness of this campaign, Doctor. Has it yielded any fruitful results?
Well, at this point, because we haven't really been visible in most of the matches, and we are hoping that now, going forward, we will be more visible in those matches, so that we are able to determine the impact of the campaign. Starting today with the game in Moses Mabhida Stadium, where Bafana are playing against Guinea Bissau. At about 10 o'clock, around about now, the event is starting in terms of the Kick TB event, right until about 2:30 in the afternoon before the game. So there will be trucks outside and some music and fun for people who can come through earlier, and they will be tested and screened in that.
Very interesting indeed. Now, do you just target the big games where your Bafana Bafanas or Banyana are playing against international teams, or you've also brought it down to your PSL level and your Mvela level as well?
Currently, it's the big games that we've been targeting, but yes, we are hoping to also bring it to the local games so that at least we reach as many people as possible. So it's still around about early at this point, but we're still engaging the PSL to try and do that.
All right. Now, Doctor, you mentioned earlier on, we all know this, that HIV is associated with TB. How do you then deal with the biggest factor in all of this, and that is the stigma that is associated with getting yourself checked for TB and or HIV?
That's a difficult part. Stigma is, we thought that by now we would have no stigma, yes, at this point, but it still remains a huge problem. One being HIV positive and having TB, that's double stigma. And what we've also found is that people don't want to come and screen or know that they have TB, because then people would think they are also HIV positive. But we're also picking up that if you have drug-resistant TB, for example, you are facing worse stigma than HIV these days. No one wants to be near you. Even the health professionals do not want to treat people with drug-resistant TB, which makes things very difficult for the patients themselves.
Let's talk about that, Doctor. What do you think in terms of research and some of the cases that you've come across, what has perpetuated that so many people are now getting infected with this multiple drug-resistant TB?
It's transmission. You know, if you are you live with a person who has multi-drug resistant or TB, you know, you find that the more you stay with that person untreated and they continue coughing, you are likely then to get infected. And depending on your immune system, you will either contain that infection or you will develop disease. So the problem that we're facing is that currently we don't treat infection. And most of us are infected with TB, but because we are able to contain the infection, we do not necessarily develop disease. So we need to then make people aware that if you develop TB disease, these are the symptoms that you will have. And then if you have these symptoms, please go to the clinic and get tested.
Talk to us about those symptoms very quickly, Doctor.
Mainly it's a chronic cough, a cough of more than 2 weeks. You should start suspecting that there's something wrong, accompanied by weight loss, especially if you have no intention of losing weight, night sweats, as well as fever. So once you have those symptoms, present to a clinic or your general practitioner, and make sure that you get screened and tested for TB.
All right. And Doctor, thank you so much for joining us. And where can people just get more information, particularly when we're talking about the fact that there's no awareness about these great campaigns that the health department embarks on?
Well, the information is there on the website, the Department of Health website.
Can they go to clinics? Can they ask about these things? What can they do?
In terms of the awareness generally about symptoms, yes. At any clinic you get there, you tell them that you would like to be screened for TB.
Is it
and
free?
They will. It is free. And the testing and treatment for TB is also free.
Doctor, thank you so much for joining us.
Thank
I wish
you.
I could join you at a Bafana Bafana game later on this afternoon. Well, that was Dr. Lindiwe Mvusi, the Director of TB Management and Control at the National Department of Health, talking to us about a campaign that is now seeking to target some huge games, your international games, like particularly one of Bafana Bafana later on this evening against Guinea Bissau out at the Durban's Moses Mabhida Stadium.